Yes, good evening, everyone.
Good evening, Danzi.
Good evening, sir. Good evening, Manjunath, sir.
Yeah.
Hi there, Shruthi.
Hey, hi.
Hello. Good to
Hello.
see you. Hello, Manjunath, sir.
Yeah, you're very fantastic. We are
Thank you
very
so much.
excited
Thank you
to
so
listen.
much for joining in this session, which is almost going to eat into dinner time here in India. But nevertheless, I think we have some, interesting person with us who will be sharing her experiences. Yes, so good evening to all other participants, everybody out here. I'm Dr. Denzi Lawrence. On behalf of PhD 101, I'd like to welcome everybody on board for today's session, which is PhD 101 Rendezvous series. So first things first. Hi there, Shruthi.
Hi, good morning. Good morning, me. Good evening to all of you.
Okay, so we have with us Dr. Shruthi Srinivasan today. Now, before I get into the whereabouts and what makes her feature on today's session of Rendezvous series, just a little bit of a small note of introduction as to the main intent and purpose of these series, which are slightly quote unquote beyond scholarly activities, is how I'd like to put it. So we at PhD 101 believe in capturing stories and which would really help most of our students to take this forward in their own ways, because in the end of it, each one's journey and way to where they are today depends upon their own experiences and how they have responded to situations and opportunities as we come across. Now, as we notice that there has been exponential growth in the field of public health, and dental public health is no exception to that. So at PhD 101, we started off with this series of Rendezvous where we engage in a casual conversation to try to know the person behind and what his or her experiences have been and what made them decide to what they actually are doing right now. So in our quest of finding out such interesting personalities, we bumped into Shruthi, who happens to be, carved a niche for herself in her own very, very quote unquote stubborn way. So that's just, a little bit of prologue here for everybody. So quickly, I think among the participants here, I'm so happy to see Dr. Manjunath sir, who's the professor and head of Department of Public Health Dentistry at PGI Rohtak. And also, I think a couple of his postgraduates will also have joined in here. And we do also have this session coming up on YouTube, so it would be streamed there as well. So before I get into today's session, I think I'll just like to take a moment and, just get in across with Shruthi and, get to know what exactly she's been up to before we get into the technicalities. Yeah, Shruthi, so your opening remarks.
So what have I been up to? Nothing, honestly, because this is the first time I'm going live, I guess. So I was quite nervous waking up this morning, but yeah, so nothing much. I had a whole day of classes yesterday, so I just came home. I was preparing for this, and I'm really looking forward to this because I think when I reached out to you a couple of months ago, probably, I was so inspired because you had an entire page dedicated to just public health dentistry. So, yeah, that's about it.
Yeah. So, for our audience who's not familiar or who don't know Shruthi as well, I just like to give out a brief introduction. Now, today we have with us Dr. Shruthi Srinivasan. She basically grew up in Bangalore and graduated from BS Dental College in the year 2017. Now, following that, she moved to the United States to pursue her master's in public health epidemiology at the University of South Florida. Now, her keen interest in epidemiology actually stemmed from the research stints she had back home in India. Now, these experiences made her realize in her conversation we've had so far, the importance of understanding how research is conducted. Now, what is the importance of data and how do you actually arrive onto sound study designs? Now, through her master's in public health, she had the opportunity to work with several researchers on various topics. Now, she always tailored her course to address the oral health issues and focused on DPH, which is dental public health core issues. Now, during the same time, Shruti also attempted the NBD exams, the really, really tough NBD exams, National Board of Dental Examinations, and cleared them. Following which, she got in, completed her MPH graduation. And in December 2020, when the world was still in the midst of a pandemic, she started the DDS program at the University of Colorado. Now, Colorado, for all our students here, would ring a bell because it was Dr. Frederick McKay about 100 years ago spotting mottled enamel, and that's how the story goes. So she's actually in Colorado, and as a clinician, as a public health professional, she has a unique eye in actually understanding the gaping chasms in accessibility to quality oral health care. And those happens to be her interest areas. Now, she also believes that you need to have a well-directed research area in order to have a significant impact even on any of the clinical sciences. So following this, I think after completion of her course, she wants to work, serve multiple roles as a dentist, as an epidemiologist, and at the heart of it, as an educator, right? So she wants to address some disparities and make her small contribution in the world of oral health. So that was a brief introduction about our speaker today, Dr. Shruthi Srinivasan, and how we got in touch. And we've had a couple of interactions. I'd like to share with our audience here that she was really intrigued by when she bumped into the page of PhD 101, and then we got in touch and then started talking, and then we were able to schedule this. So we totally believe in catapulting these energies and synchronizing them across. And it's really nice to hear from students who've been in similar paths. So we do have a lot of students, who have what if and how are they going to plan abroad, or how did they pursue. So I'm sure today your experiences, what you would be sharing over the next 30-40 minutes would give us an insight, Shruti. So I really have a rough framework of questions, and we're just going to keep it very, very casual and informal. And yes, let's have some fun.
Okay. All right.
Okay, let me just allow you to screen share. Yeah, you can go ahead. Meanwhile, I think for the participants, if you all could quickly put in your introductions, your quick intros, your name, your college and affiliation, it'll be very helpful for us to initiate a chat and to have a discussion in that direction.
All right. Can you all see my screen?
Yes, yes.
All right. So it's a very small, it's not even like a presentation. It's just like a bunch of photos that I put together. I wanted to keep it really light and not talk so much about me. But so this is just my education. I studied at VS Dental College in Bangalore. I graduated in 2017. And then I pursued my MPH in epidemiology at the University of South Florida. So I graduated from that program in 2020 December. And then currently I'm a DDS candidate at the University of Colorado. So I currently live in Denver. How do I move? All right. So yesterday when I was compiling, I was just trying to make this presentation. I came across this picture in my Google Photos and it said 8 years ago. So and then I was like, oh my God, it's been 8 years since I was in first year college. Like, where has all the time gone? And I found this picture of this tooth carving from our first year DADH class. So I just thought I should put it over here and say, this is where it all started. And then, so this is just a couple of pictures from my time at VS. We used to have a lot of fun besides studying. We were part of we just take part in all culturals. And the first picture on the left is from when we used to have this newspaper during our culturals called the Daily Prophet. So that's us holding the newsletter. And then the last picture is of this IDA dental conference we attended in Dharwad with one of my oral pathology faculty. So that was the first time I presented a paper. So these were like some really pivotal moments. And this is the last group picture. In between the last group picture we took as a batch at VSDC. So these are some pictures that I thought were important. But moving on to why I picked epidemiology was because so when I was in fourth year dentistry, there was the Indian Dental Association came up with the student research grant. I'm not sure if they still have it or if it's still an ongoing project, but they were ready to fund 10 of the best projects in the state of Karnataka, one from each discipline of dentistry. And when I just submitted my abstract for a randomized control trial, and it was just supposed to be a 3-month project. And when I did that, it turned out to be, it actually got selected under the field of oral surgery. And that's how I got started in research. So the picture that I have here is, they were giving me the IDA Student Research Grant, a certificate in Harvard. So, so this is where my interest in the field of epidemiology, research design, study design, biostatistics, and all of that started, because I had a lot of difficulty trying to understand, oh, why would I have to do a randomized control trial? What's the difference between a cohort and a case control study? Why would I have to do such a kind of statistical designing? Like, what is the reason behind a chi-square and not a t-test and things like that? So that's where it all started. And I also realized that irrespective of which stream of dentistry or any clinical science you are in, if you want to make a contribution to it, research is very integral to it. And if research is integral to it, it's good research which is integral to it, right? So that's why I decided to go ahead and study epi. And then I moved to Tampa, Florida within like 6-7 months of graduating. So this is on the first day of campus. I have a picture on the right. The left picture, it's like Google suggested it because Tampa is supposed to be the lightning capital of the United States. So it's a very nice, very pretty place. And then this was my time at USF. So at the College of Public Health, we used to host a lot of public health drives and like programs. So the pictures where I'm wearing the green t-shirt, it's because we were having the flu shot drive, and flu shots are advocated a lot in the United States. Like, everyone wants to make sure that you're getting your flu shot. So they literally get all the College of Public Health students to go spread awareness in the community, on campus, off campus, get people to the college campus, and then we tell them about, like, flu shot, why it's important, and all of it. So these are pictures from that. And then on the right top, there's a picture of me presenting one of my research papers at the on Student Research Day, where I got involved in cancer epidemiology with a professor who was working on oropharyngeal cancers. And she really helped me understand how things such as microbiome is so small. They're just like, tiny bacteria and their genome, and how they have such a pivotal role to play in oropharyngeal cancer, and how as epidemiologists, you don't have to go about, cutting and pulling out all the bloody mass and tumors, but there's still so much you can do in the field. So that's a picture of that. And finally, just a picture of my graduation, except I did not graduate on that day. There was no graduation. I just wore that, went to campus, took a picture, and pretended like I graduated. And then this is at CU Anschutz. So I did not have any pictures from the University of Colorado. So I ended up taking some pictures yesterday. I was like, I need something for the presentation. Can we all take some pictures? So this is from that. So this is just my small journey, but besides all of this, I also have a lot of fun. I go around, I have a lot of fun. I just eat, chill out with friends, go out for dinners, go see places. So yeah, it's just not restricted to that. So this is just a very small, brief introduction and a small presentation that I have. That's it.
All right. So I think that was really nice, to quickly go through and get some perspective into what it feels, to have witnessed Shruti's journey. Okay, Shruthi. So I think it's time for Viva now.
Can I stop sharing my screen?
Yeah, you can, please.
Okay. All right.
So I'd just like to put a word of out there to the audience. Anybody would like to participate throughout, feel free to switch on your videos, unmute yourselves, and please do chip in. Let's make it really casual and interesting. Okay, Shruthi. So beginning with some of the questions which would probably be in the minds of most of our students here, right? There are postgraduates pursuing dental public health here in India, and the couple of interns who are looking for What was your moment of realization which made you pick this up? In fact, that when it comes to picking up on, you got hooked onto epidemiology, and then, you stemmed out into various arenas, right? So when did it happen during your undergraduation? Like, primarily, if you could describe that to us.
Mm, so I won't say it was just one moment. It's like I never had that, oh my God, this is like my eureka moment or anything like that. But there were like a series of events which ultimately led to the decision. One being, like I mentioned, I got involved in a couple of research projects as a fourth year student and an intern at VS. And besides the oral surgery research project, which I was involved in, there was another one where we were trying to, a co-intern and I were trying to look at tobacco usage amongst high school students. It was just a cross-sectional survey. And that time we just pulled out a survey and we thought, oh, it's so simple, let me go distribute this survey to everyone in Bangalore City High School. And that's it. They will answer it. I will just like write down what everyone is saying and done. But then I remember going to Sushi ma'am, and she was like, where's your sample size? How did you arrive at this? Like, where is this 3,000 number? Where did it pop out from? Like, randomly. And I remember also my professor, Dr. Samya, was like, did you guys validate this survey question? And I was like, what is validation? Like, what is it? So I think that's when I realized there was so much more to learn, and you just can't go about doing research just like that. So I would say those were some very pivotal moments for me in realizing, I've always wanted to be in the field of healthcare and medicine, and I've always wanted to be a clinician, but I also want to be a clinician who's going to contribute to the field in some way by helping it advance. So, and I strongly believe that research is a very important way to help a field advance. So I would say those were some moments when I realized I had to learn how to conduct research in the first place. Yeah.
Right. So, going by your experiences, like probably those were the few pertinent moments where it actually struck to you that you need to read up more on that. Coming to my next question is, how did you equip yourself in the process? Because yes, research was something which intrigued you, and yes, I need to know the methods, the methodology, and how do we go by it. How did you direct your goal towards that? Because as you've mentioned, you enrolled into your MPH course, which gave you sound understanding. But then your affiliation towards getting back to clinicals is what led you to get into your DDS program. So how did you connect between all of these things? Like, how did you make sure that you're going strong fundamentally in research and also relating it to your clinical quotient, which you've always wanted to do?
When I was at USF, the first couple of courses are core courses which all of us take. So they equip us in basic methods, basic biostatistics, and also give us a more broad view on health policy, environmental health, and all of it, but maternal child health and all. But once we were allowed to start taking up our own courses, that's when I started. I would talk to my advisor a lot. I would tell him, he was a pediatrician. So I would tell him, as a person who's coming from a clinical background, how you want to make a change. He knew it. So I was like, that's exactly what I want to do, but I want to do that in oral health and dentistry. So he would help me take a lot of research courses. Like I took courses in research methods and evaluation. Program evaluation was another field that I really liked once I got into USF. And then just taking epidemiology 1, 2, and all my biostatistics course, data, categorical data analysis, statistical computing, and things like that. So that's how those were the basics. The courses were the basic methods in which I actually gathered all information. But to put it to practice, I ended up working on a couple of projects with a few professors. So I was literally putting all my knowledge into practice. And every time every class would have a project for us as a culmination, and every project that I took up would be dentistry related, whether it's a pediatric prevention program or or an orofacial cleft program, and how barriers to accessing care amongst them was, or like I think a geospatial mapping of oral diseases and things like that. So I would always tailor the tools or the research methods that I learned in a class, and I would literally apply it to an oral health issue, and I would have a professor grade it. So he would tell me, oh, I don't think you can do this because this is not feasible. And because we were when we get divided into concentrations, we're very small. We're a very small cohort in the um, entire university, so they had a lot of time to actually talk to us one on one and tell us, this is not how you do it, this is not the sort of survey, these are not the sort of questions you come up with in a survey, this is the sort of test you would do for this analysis and things like that. So I think that's how I ultimately ended up equipping myself with some skills. My thesis finally was also on disparities in addressing oral cancer care. So I had a lot of one-on-one mentorship and guidance to carry forward, to take my research forward. But I still don't think I'm really good at it, but I feel like I'm at a place where I'm able to understand and apply it at a much better level than I was when I started off.
Yeah, I think that's rightly said, Shruti, because I think at every point of time, you try to establish a link by taking the oral health issues so that you remain, more connected with the core issue. And let's say you just, navigated yourself through, and you were really fortunate to have really good mentors around you and go this across. Now, how fascinating was oral surgery for you as a clinical specialty? Because what normally happens in undergraduation is you go by a lot of opinion which is shrouded around, and you don't really know how much can you attribute it to yourself. But then how badly you wanted to be an oral surgeon right after, let's say, final BDS and all of that. And how do you think you're going to package the research quotient in that and take this forward from here?
So there's something I want to say. So when I was in like third and fourth year, there were two things that I was interested in: oral surgery, public health. And everyone would tell me, don't be interested in these two. Be interested in, like, why not endo, prosto? I was not interested in them, but so they were always like, these two, why? But I feel like some of like a lot of a lot of issues that I have been dealing with at a public health level, besides caries, besides periodontal health, have a lot to do with oral surgery, like clefts and oral cancers and all of it. So I feel like there are a lot of documentaries that I've been watching, and what I feel is a field that needs a lot of attention is how global surgeries are being conducted off late, and that's where I feel like the field of oral surgery and public health really intersect, because I can't just, I mean, everything needs to be planned. There's a policy and there's a procedure. There's a methodology in which you have to go about as an organization conducting global surgeries. So you just can't take your scalpel and say, I'm going to go to a country which has a very high incidence of clefts, and they are not doing so well economically, and I'm just going to go start cutting. That does not make sense. So I feel that's where public health and oral surgery and the whole field of dentistry comes into picture, because a lot of clinicians and surgeons may not understand the other side of the field that they're working in. Like, how if I'm able to go for a mission trip, I probably, if I didn't have the public health background, I wouldn't know how the whole setup was made in the first place. I wouldn't know who was pivotal in arranging it. I wouldn't know why that region was selected, what the incidence of the disease in that region was. I wouldn't know any of it. I would just go do my work and come back home. But I feel that's specifically the sort of field I would like to work in, like global surgeries and geospatial mapping of diseases and all of it. So I think, would I have done oral surgery immediately after BDS? I don't think so, because I was always looking for this a perspective from the other side. I was always looking for it. So I think I wanted to be a little bit more older, more informed when I took that decision. But yeah, so that's just where I feel both the fields intersect.
True. So, talking about your experiential learning, what you've had soon after your undergraduation, right? Like after your BDS, did you try your hands at any clinical work? Like, did you intern at a clinic, maybe just to like, were you never attracted towards clinical practice? Because that could have possibly been one of the starting points again, eventually to do what you wanted to do. So, how was it right after your BDS?
So honestly, I was not interested in a clinical private practice. I never was, but I did intern for like 3 months. I think I used to go to a private practice while I was an intern, because it was like, word of mouth. Everyone tells you, go learn the job. You need to do it. So I was like, okay, fine. Maybe I don't know what is on the other side. So let me go just work at a clinic. And I did not like it at all. Like I was like, this is not what I want to do. I did not like how narrow it felt. Like I felt like I was just restricted to that particular space and I could not venture out more. I wanted to do more, except back then I did not know what more meant. Um, and I always felt very dissatisfied. Also, the sort of procedures I could do as an intern were very limited. Like I could do a couple of scalings and prophylaxis, probably a few restorations, and I was like, this is not what I want to do for the rest of my life. So I did not like that aspect, and I'm sure there are a lot of practitioners who are doing very well right now. Private practitioners, they probably they have when they have their own practice, the scope of a practice is also much more broader. But as a person, as an intern working back then, I was not very satisfied. um, and I, like I said, I knew I wanted to do more. I just did not know what more meant. So I quit after 3 months. Yeah.
Okay, so yeah, Shruti. So I think I'll pick on that interesting combination. What you mentioned, like like you were definitely sure of what you didn't want to do. That is, get yourself, stuck between four walls and trying to drill and fill cavities for the rest of your life. So that's absolutely what you never thought of. Now, coming back to some questions on what your opinion is about the existing curriculum. Okay, you're someone who've been exposed to different sets of universities, and you've been, I mean, there are good and bad everywhere else. But do you think here back in India that do we have a proper transition between undergraduation and post-graduation in terms of, let me just break this down for you. At the undergraduate level, you've been instructed on how to do things, okay, not necessarily understand the why, what, and behind everything. So you're doing a lot of mechanical work, but you don't really understand. So there arises the need for post-graduation. But then, like you said, we were all confused back then and how to pick specialities. Like, how do I choose among all the 10 subjects after merely having given one or couple of internal assessments and maybe probably just cleared a final BDS examination? So the ability to choose a specialty, okay, a lot of the students here go by default choices. Like I said, popular choices, what they want to do, but maybe some like you, or very few like you, who choose to do something beyond that. So what's your take on the existing pattern, and how difficult or how easy it was, if there are some curricular aspects which helped you, or something which you wished for you had back in your undergraduation?
Okay, so curriculum wise, quite honestly, theoretically, India's amazing. Like brilliant. Like we are taught, at least at VS, I was taught by really good faculty right from first year until I, finished my fourth year. Like everyone, they would like, we would follow the most standard textbooks and we were taught really well. But and also at a clinical level too, I felt like we were taught quite a few procedures, not a lot, but what was possible as an for that at that time for a student who was an undergrad was at an undergraduate level. So all that was covered quite well. But where I feel the transition could be a little better is a more like trying to understand what we study at a more practical level, as in so in operative, when we study cavity preparations and all of that, we get to do it on the patient. But in a field like public health, where we study program planning and evaluation, or we're like epidemiology of caries, and you go on to biostatistics, and they're like, chi-square t, what, don't learn all of this, it's not important, like just let it be, you don't have to know what it is for, and things like that. So that is where I feel like a more practical application is important. It's not just it's not okay to just go on camps and come back because a lot of people go on camps, have fun, and come back. They probably don't learn in those camps. So and people have this opinion that, it's such a dry subject, why is it so, I don't want to learn so much theory. But in reality, it's not so much theory, it's a lot of concepts which need to be applied. So I would say, if we could, like, do these little projects like how we would in school, back in school, like, you do these little group projects, you come up with your own research idea or a question, and you work on it in little teams. And I think that's where a lot of people might actually end up liking the subject. So so if I were to teach like program planning and evaluation, I would make them plan a program and not make them by heart the steps, because that way, when they plan the program, they know exactly what steps they went through. So they just know it. They don't have to learn it through a textbook, through rote memorization. So I think that's one place where a slight curriculum change could make a huge difference. And we might end up recruiting so many people into the field just because they realized how fun it is. That's one thing. And this is something that I wish I had when I was in third and fourth year. But this is what I feel should be a big change.
Yeah, rightly said, Shruti, because this is something which we all encounter, and probably a couple of teachers here who've joined us will also second the same opinion. A lot of public health has to be taught in the right way. Like there's a demonstration for a certain operative or a prosthetic exercise, there has to be an suggested activity for public health as well. Only then you are able to imbibe and inculcate the concepts. Otherwise, whatever bounces across, it's watching a film without any subtitles, and you don't know what's happening. So that's pretty much what happens in curriculum here. Now, public health dentistry or dental public health here, right? If you look at the topics, what you've actually covered, now you were able to pick on the interests, correlate your penchant for oral surgery and research, because public health dentistry, as it is taught in India, is by far the broadest discipline, which has the maximum number of subjects under it. So if someone wants to really know the art and science of practice management, or if somebody wants to get into jurisprudence, or maybe even into monitoring occupational safety health, I mean, it actually stems, it gives you the likelihood of liking so much more according to your own preferred choices. So what we need to do is, I would just add on to what you just said, is the way we teach the various chapters in public health dentistry, it would be better if we devise them according to a curriculum framework which would evoke curiosity. So if somebody attends a session on dental practice management, he or she would be, if they're naturally inclined, they would probably take up more and find out about the clinic design and how do you market and how do you schedule appointments and how do you like run a business, dentistry, the art and science and the business of it. Or if somebody like you really wanted research as a core discipline, because we teach research methodology and biostatistics. Okay, so if you teach it the right way, you're doing a great service to students who really benefit from it. But if you teach it the wrong way, the whole possibility of you ever going into one of these professions is entirely ruined for it. So I think it's time we stopped revising the textbooks and added more content into that, and probably revise the way we teach our specialty. And that's something what we're trying to do here at 101 as well. So thank you so much for that quick bit. So going back to some of my other questions which I had for Shruti here, um, how was it? I mean, how was it decided? That you would get into masters in public health, and you picked on epidemiology, which you've already mentioned in it. How was the whole course structure designed, which helped you relate, and eventually, what was the decision for you, to give the NBDs and get into it? Was it through the process of MPH, or was it something you're getting to the end of it, or was it always laid out that I shall, get into DDS, but MPH will be something which will help me get through that? So how was it in that direction?
So it was always laid out that I would do it. But I didn't know when I would do it. Whether it was at a much later point or much earlier, I was not sure of that initially, like when I was in fourth year, fifth or internship. But and then, like I said, I was working in that private practice, and I was like, maybe dentistry is not for me. So I always wanted to do more. So that was the point when I decided I wanted to do something else, broaden my perspective, and I wanted to get my public health degree at that point. So I was not looking at the DDS when I was finishing up my internship. And once I got into the school, and then I was like, okay, this is manageable for me. I will be able to finish public health on time and all of it. That's when I started looking into, I revisited my intentions of doing the DDS, and I had a slightly easier course load in my second semester. So I was like, okay, let me attempt the exams now. When I had like a 3-month long summer break after my second semester. So that's when I was like, oh, I was just like, I didn't have anything to do. So I started studying for my second part, national boards around that time. So, and also like I've, a couple of people have been mentioning that I've been school hopping, literally went from one school to the next school to the next school. So I think in a way that's good, because I'm like sort of keeping in touch with how to study, and like, I'm always in a student mode. So that is not, that's actually been really helpful, I would say. So I'm actually glad I did them one after the other, instead of revisiting at a much later point where I probably wouldn't be able to get back into the groove of studying. Yeah.
Okay. School hopping, right? That's a nice way of putting that. All right. So Shruti, how would you advise students who would probably wanting to get into the DDS program, of people, because there's a lot of thought and illusion which goes behind it, and what is it to prepare? How difficult is it to crack the part 1, part 2 examinations? If you could just give us a little bit of insights, because we do have a couple of undergraduates attending this session today.
Okay. So, if you go on all of these Facebook groups or WhatsApp groups, and they're like, oh my God, it's the most difficult exam. You have to study for 6 months. It's not true. It's just meant to scare people. In my opinion, if you study well in your undergrad, like, if you listen to your teachers and just study your Karanza, and if you're studying your, like those prescribed textbooks that they ask you to, it's an easy cakewalk. That's what I would say, because it's not anything out of syllabus. It's not, dentistry is not different from over here is not different from dentistry in India. Maybe the practice is, maybe the practice management is, maybe the scope of practice is a little different, but theoretically they're both the same. So I would say just like give it your, like sit down for a month, 20 days to a month, and you're done. Like, it's not as hard as they say it is. You just need to study well in your undergrad, get your concept straight the first time, and it's quite an easy exam to crack. It's like, like just like revise through everything once, and then you're fine. That's what I would say. And if you're still feeling a little underconfident about it, study for another extra month. But trust me, no one needs to study for 6 months for each of the boards.
That's really supportive and encouraging, Shruti.
Yeah, there's very little time. No one has the time to study for 6 months for each part, like there's very little time, so optimize it.
Okay. So moving on, how is life at the dental school? How different is it? Because it's been 4 months, right? You've just gotten. I mean, of course, in the middle of the pandemic, so there would be restrictions and all of that. Honestly, how was your first day at school? Actually, having reached where you've aspired to be, though you've taken a very tumultuous path, which has taken a toll on your patience and learning. But then, how was it? And if you could describe us that experience.
So the first day of school was not what I expected it. I did not like it. It was so cold. I've never lived in a cold place in my entire life. I moved from tropical Bangalore to tropical Florida and then came to cold, freezing Colorado. So I did not like it. I couldn't breathe. I had a lot of altitude sickness, like, because it's quite high. I was like, is this where I've come to? Maybe I should just go back. I don't want to do this. But right now, right now, I really like the program, I just realized the people are very nice. The school is amazing. They're very encouraging. There's so much to learn. There's always so much to learn. So I really like that aspect of, I don't feel like I'm repeating a degree. Literally, I don't feel like it, because every day I'm learning new things. And I feel like since 2012, which is when I started school, I've been learning new things every day. Nothing's like a repetition. So I'm really happy to be where I am right now. And now that the sun is out, I'm even more happy. So yeah.
Okay, so that's a pretty honest answer there.
Yeah.
All right. Okay, so I think and we can have the audience chip in right now. Yeah, I do have a couple of my questions remaining. Before that, I think let's just put on. I request everybody if you could just switch on your videos and let's all of us look at each other and let's have a quick Q&A here. Yes, welcome, Manjunath sir. Hi, Nash. Hi there.
Yeah, Dr. Shruthi, very nice seeing you. Very good morning.
Very nice to see you too, sir.
Yeah, Nash. I think if quickly everybody
so
can
like
say.
my question to you is like, you started with MPH. What was your like? Why did you shift to DDS? Like you thought MPH there are less scope or something like that?
No, absolutely not. I don't think MPH has less scope or anything. In fact, if you look at the range of practice, it's much more broader for MPH. The reason I switched, I wouldn't say I switched to DDS. I did what I've always intended to do, like be a clinician with a research background and do both together. I cannot be a clinician in this country because I don't have the license to be one. So this was how I could get a license to be a clinician in this country. So I would never say MPH has lesser scope. It has immense scope world over, in my opinion.
Yeah, thank you. So like during your internship, you made up your mind to do MPH, or like what was your motivation like to do MPH?
So like I said, I was involved in a few research projects in fourth year internship and all. They were not big ones, very small projects. And that's when I realized that I did not know how to go about doing it at all. Like, I didn't know how to collect data. I didn't know how to analyze my data. I remember for my and I did this small 30 patient randomized control trial. Every time I look at it, I think of the amount of bias I've incorporated into it. And I keep laughing at myself. I'm like, how could you do this? Like, what have you done? Why would you take such patients? Why did you randomize in such an unrandomized fashion and all of that? So that is where um, I think that was very important for me that was a very important moment for me to, where I realized I wanted to do public health, and I specifically wanted to study epidemiology. So when I look at, I mean, I'm not saying right now I would design great studies and my data analysis would be perfect, but it's much, much better than what it was when I started off.
So most of my PG students are also there. So they would be interested, like if they have some dreams of pursuing MPH, So what would be the cost of pursuing MPH there in US?
So it can honestly range from a lot of money to very little. I spent very little on my MPH because firstly, I went to USF, which is a state school, and it's a very good school for public health. Like it's one of those very highly ranked schools, but it's a state school. So the tuition is very less. And also, the moment I got into my public health program, the first semester, I had to pay out of pocket. For my second semester, I had to pay a little bit out of pocket, but for my third semester, my entire tuition, health insurance, everything was covered. I was even given a stipend because I used to work for certain professors on campus. And these opportunities are not rare. They're not rare. Like if you were to go to, it depends on the school. Just do your research when you apply for an MPH program. Like I had professors I was a teaching assistant for an introduction to epidemiology course. I was a teaching assistant for an introduction to health professions course. I was a research assistant for two for one program planning evaluation and one oral cancer epidemiology research. It's a lot of work. I used to go to school. I also used to work for 20 plus hours sometimes, but it paid my tuition in complete. Uh, they would give me health insurance. They also gave me a stipend. And so I didn't have to ask my parents for money every month to pay my rent and buy food and all of it. So I would say just do a little research. And if anyone needs help in picking a school which gives out a lot, which has a lot of funding and gives this out, just let me know and I can help you out. Like you don't always have to pay a lot of money to get quality education.
That's actually a very valid point. No, there is a misconception among students that it does cost a bomb. It's again how well you score, your entry level scores, and the qualifying examinations, and then how you pick on whether it's a state sponsored program or it's a private university. I mean, generally it's all subsidized, and the various possibilities of in campus. I mean, I've had. Couple of my friends do and say that. I mean, actually had to listen to them to believe that this is actually possible. The problem here, I think what Manjunath sir rightly raised here is we are so programmed to functioning in a certain way that we don't really look at lateral opportunities and how you could, pursue research while studying or when you're doing this, a lot of all that. So I think that pretty much sums it up. Yeah. Yes, Manjunath sir. Anything else you'd like to? We can ask any of our postgraduates here. If you could ask any of your PGs, because what are their thoughts? We'd really like to know. We have Srinidhi here, who's just got into post graduation. We have Vinamrata. We have I think Shreya as well. Yeah, Srinidhi, go ahead. Yeah.
It was such a nice talk and to the point. I think Sir has asked all the possible questions.
Yeah, I think we have a network issue there. Yes, could I ask Nash meanwhile? What are your thoughts?
Yeah. Oh, hi, Nash. Yeah. Hi, Shruthi. Hi, Denzi. Hello, everyone. Thank you for the wonderful talk, Shruthi, from, as you rightly said, from Bangalore all the way to Colorado. You guys here? I think someone else is.
Yeah. I'll just. Yeah, you can go ahead, Nash. You can go ahead.
Okay. I do have about 2 or 3 questions. So my first question is, well, I'm a clinical research fellow. So it goes, and I did my education in India and then came over to England. So I can relate to a lot of what Shruthi said. So my first question is, when I first came here and they asked me to write an article or write up something, the first thing was, how do I go about it? How do I start? And then I had to research the net for different things like, how do you write a protocol? How do you write a methodology? How do you write an outline? How do you write an abstract? And the other thing was, you read so many journals and all of that, and you also have to learn how to critically appraise it. So how did you do that? I mean, did you have a similar situation where you were scouring the net for different things like how to write your protocol and how to even read a journal? Because I think there's a big difference between casual reading of a journal and reading it for, or reading it in a really nice way to get something out of it.
Yeah. So I think when I started the program, the first exercise that we would do in most classes was to write a research paper. And I would, the most difficult aspect for me was to understand what is quality paper for me to put it in my paper, because I would just take anything that I could find, I would put it, I would cite it and reference it in the wrong format. I would have all these, and then I would get like points knocked off, and I used to wonder, hey, what's wrong with this is how I've always done it. And then I sat with my professor one day, and then he was like, listen, when someone says, you know the way a lot of studies can get rigged, and this is how you look for it. That's when in my epi 1 course, he used to tell me, like, people can say xxx drug reduces cholesterol by 41% or something, but did you see their sample size? It's so small. It's going to look like it's so, like the entire, it's going to work on the entire population. It's not generalizable. So that's how I started picking up a lot of these things over time. And referencing was always an issue. And then I learned certain citation tools and like EndNote and all of it. And so that's how I got started with writing a research paper. Am I really good at it even now? I don't know, but I think I am quite good at writing a research paper at this point. And when it comes to protocols and grants, I never wrote a grant by myself or a protocol by myself, but as a research assistant, I did help my professors write certain protocols and grants. And I've seen the amount of work that goes into writing a grant, because I feel like you need to literally write a research paper before you write a grant. Right? And that is where I would come into picture, like collate all possible information and data possible. And I would sit with them and see why they were designing their surveys a certain way. Why was this question asked open-ended versus why was this question asked closed-ended? How focus group interviews were designed and all of it. So I think the whole process of learning is very practical. There's no one who can actually teach you how to do it. You need to see it, you need to do it, you need to make mistakes, and someone has to tell you, listen, this is not going to work because of all of these issues, right?
Go on, sorry.
So someone has to tell us why a certain thing would work, someone with a lot more experience, and who's like written several grants and won a lot of awards, and not won a lot of awards, but a lot of grants. But they would have to tell you why a certain thing would work and why a certain thing would not work. So I think it's a learning curve. That's what I would like. One of my professors that I got involved with was working in a very niche field. She was working on microbiome cancer epidemiology, and it's such a small field. I didn't even know what the microbiome meant. And she was literally trying to carve her path in that really small field as an epidemiologist. And her grant writing was fabulous. I learned a lot from it because, she really has to convince people, like really big organizations, that this is important, So, yeah, so I think it's a learning. I don't think anyone can teach grant writing or protocol writing.
On the same note, can I assume that being a teaching assistant helped you in your course, not just because of the economic benefits, but it also helped you learn on the job and get much better at it? I mean, an MPH without you being the teaching assistant and an MPH with you doing the teaching assistant job for the last 2 semesters, that really helped towards your degree. I mean, that really enriched you. I mean, would you agree with that?
Yes, absolutely. Because so I was a teaching assistant to 2 undergraduate courses, and when you end up and as a result, you're the first point of contact for the undergraduate students. They don't approach the professor because there are so many students. And when they come to you with a problem, you realize, oh, wow, I've actually mastered certain concepts of epidemiology and it comes naturally to me now, because you've learned it. So you teach them so many times that you've learned it so well. And I think in a way it also, as a teaching assistant for an undergraduate course, it also helps you shape what an undergraduate student might want to pursue after their course. So in that was another thing that really uh, which I found was really important, because I could tell them, hey, you know what, epi biostats is awesome, you should come this side, and things like that. So yeah, I think it was a very enriching experience being a teaching assistant.
Great.
All right.
And Denzi, when you were saying about people teaching you and inspiring you to follow a certain subject, I was just reminded about my mathematics classes back in school. It's a great subject. I love calculus, and just because we didn't have the right teachers back then, I missed out on so much fun on trigonometry and calculus. But now I want to learn calculus, probably someday. But I could just think when you said
No,
that.
I think right, Nash, it all boils down to the teacher. It's not
Absolutely does.
exactly what it is. It's how it's taught. I mean,
Yeah.
I think most of us here, I mean, we came towards life sciences probably because we weren't taught, the rest of it that
The right people to teach us
right
maths.
way.
Yeah.
All right, great. Okay. So quickly, if we can have any of our students share some of their thoughts. I can see Shreya. Shreya, could you please introduce yourself and let us know? And if we have Srinidhi back with us here, probably you could just put across.
Am I audible?
Yeah. Go on.
Okay, allows me. I would like to ask ma'am that tell me your experience as you have practiced there, like about clinical public health, like clinical aspect of public health, if you are okay with it.
So, so the clinical, unfortunately, I'm not a very good person to talk about it right now, because I have not yet ventured into that field. I'm still in the process of getting into the whole clinical part of it. But I do know people who got into dental public health residencies after their MPH and their dental, their DDS over here. The scope of work is very similar to what we would very similar yet different to what we usually do in India, the same, but I would again say I'm not sure how exactly it is done in India, because I was never a master student in India, so I cannot comment on it right now. But I do know that they're very involved in research over here, even as a dental public health practitioner. After residency, they usually work for the state departments over here, and they come up with a policy, like the oral health policies for the states on a yearly basis. They conduct a lot of program evaluation. They have a lot of these programs, right? Like they have miles of smiles and give a kid a smile program, and all of these dental public health programs. And most dental public health practitioners work on evaluating these programs besides just designing them. So I feel that's where I think that's their main that's some of the most important things that they do. They come up with policies, they design programs, and they evaluate programs over here. So that's like the main scope of dental public health over here. But I also know that they do a lot of clinical work. Unfortunately, I don't know what procedures exactly. But I have a couple of friends, so I can ask and find out. A couple of seniors over here, so I could ask them and find out.
Okay, thank you.
Yeah, I think just adding on to what I think Srinidhi wanted to know about the scope for clinical practice.
Okay.
Just to give you some added information, Srinidhi, probably you're looking at clinical aspect of public health here. What we do practice, what we make you all do here in your post-graduation is, of course, most of your preventive treatments and then everything else. But let's also remember that the basic classification of a clinical specialty and a non-clinical specialty is inherently flawed in our country, because all of dentistry is clinical. Okay, everything revolves around your patient. It's just that in dental public health, your patient is your community. Right. So, I mean, I've had this fortunate experience of discussing the same thing with Dr. Chandrasekhar Jankiram sir, and sir did share a lot of information on that. because when he was pursuing his DPH residency program from the NIDCR as well there in the States. So he told me that, yes, we do everything that quote unquote the other clinical specialties do, but then it's more population oral health. It's more directed at as evaluation of, let's say, a CLIN program or maybe comprehensive oral health assessment and all of that. So I would put this in this manner that people with a dental public health background, like you are grooming yourself to become one, definitely there is a scope for you to go on and pursue residency and stick on, to do it. But then, yes, you don't get to practice clinical dentistry. You need the license, and that's why Shruthi is doing her DDS there. So apart from that, again, you could be concerned with a lot of evaluation and monitoring of programs, and also look in for fellowships and so much more. So there's plenty of opportunity there, and to so much more which is there to be explored.
Thank you. Yes. I agree to the point that the system of this thing is flawed, that the division. Yes, I agree.
I mean, this happens because, it has practiced in the medical specialties. Probably Nash would know this. And we're talking about classifying anatomy as a non-clinical and probably a medicine or a surgery specialty. But that doesn't apply to dentistry, right? All of dentistry is clinical. It's just that there are various tenets to it. A medicine specialty would focus more on the clinical science and be to radio diagnosis. I mean, if you look at the evolution of dentistry, I would say just as how different the teeth are from the rest of the body, that's how different dentistry is from medicine. Integrally, it's a part of it's part of medicine, because it is the scientific judgment, it is diagnosis, it is treatment at the end of the day, and we are dealing with a certain part of it. But the way the specialties have evolved, a lot of students have this problem. They are having a mixed thought. They think that dental public health is probably non-clinical, and many colleges endorse this as well, and many of the faculty members. So there's nothing non-clinical in dentistry. It's just that even if you're an oral pathologist, you have to be thoroughly stemmed with your clinical, because in the end of it, you are related one-to-one to the patient, and then your specialty comes henceforth. So a lot of that is there, and that's principally how dentistry has evolved from medicine as one of its core branches.
Absolutely.
Just like to add on a little bit. Sorry.
Yeah,
so, I think just as rightly as Denzi said, we should all have a very good vertical and horizontal integration of all the specialties, everything, and get a 360-degree view of the whole thing. And I think by doing that, we'll probably get to more solutions rather than staying rigid with these divisions. We should all probably, get a holistic picture, and I think everybody should do that.
Yeah, we need to go transdisciplinary approach,
Yes,
across. We need to do that, like Nash pointed out, because see, in the end, specialty is for ourselves and how we advance the subject for teaching and learning. If you look at patient-centered approach, which is practiced everywhere from UK to States to even in India right now, I think it's more about working together collaboratively and then working. So like Shruthi found out her penchant for oral cancer and public health. Like oral cancer is a public health concern, and there's so much to be done in that direction. So we need a lot of research and epidemiological, statistical evidence to plan programs, let's say for a national oral cancer project, or mitigation of or even rehabilitative and tertiary level care for cancer survivors, especially because given the aggressive nature of oral cancers and the spread and the metastasis. So a lot of that. So specialties is, yes, I think after your post-graduation, and this is what I would tell the PGs here, like go back and revisit and start working with disciplines across, getting a better perspective, and then working on your core areas, and then taking this forward. Yeah. All right. So I think do we have any other students here? Any of the UGs, or are they too scared to talk? It's okay, guys. Shruthi ma'am will chill you out.
Oh man, it sounds so weird to call me when you guys call me ma'am. I'm not a ma'am.
Yeah.
Yeah.
So yes, I think Dr. Amit, we could see you a little while ago. I think Manjunath sir is still here. Dr. Shivani. Yes. Shreya was here a little while ago. Any of the undergraduates would like to ask or pose a question here? I think, yeah, I think we have Manjunath sir back again. Yeah,
It was
Shreya,
very
go on.
wonderful
Yeah,
interaction.
Manjunath sir.
Uh, how was your experience with the MPH, like in clinical epidemiology? Your MPH you had done in epidemiology, right?
Yes.
So, what was your project? How was your course? How was the curriculum?
The curriculum, what I really liked about the curriculum was I could, besides a few courses which were compulsory, I could pick exactly what I wanted. Like, oh, this is what I want, so I'm going to take a course in this. This is what I want, so I'm going to take a course in this as well. So I literally, so being quite honest, the MPH degree is not focused on, most people in the MPH course, even if they're dentists who come from India, don't focus on oral health. And that is the truth. Like, they actually branch into other fields. They're like, oh, you know what, this professor is working on lung cancer, or this professor is working on colorectal cancer, let me go work there, or let me go work on making the campus tobacco free, or like make the roads more walkable. So they don't do a lot of things related to oral health. But what I did with my curriculum was I literally tailored my entire MPH degree to be an oral epidemiology related degree. Like, I made it so clear that I was only interested in working on oral health projects. I mean, I did work on a few other projects because it was there and it was nice, and it was a learning curve, but everything that I did was I tailored it to my needs. If this is what I've come here to become, an oral epidemiologist, and that is what I will do. And if you are quiet, if you're very clear about it, you will find mentors, even if they're not in the field of dental public health. Like, I found my mentor who was a pediatrician, but he was ready to guide me. He was like, all I need to know is the methodology and how to conduct research. How does it matter if it is about a child with spina bifida or a child with dental caries? It does not matter. So you just need to find a person who's ready to be your mentor, irrespective of what field they are from. And you need to be clear about what you want to do. So I would say my MPH was I was very happy with what I did in my MPH. I literally tailored my curriculum to what I wanted. So I was very happy about that. And the curriculum is very free actually. You don't only have to take courses in the School of Public Health. I know people who took courses in the School of Anthropology because they wanted to learn how human behavior works a certain way. And like, I think there was one person who was working in the School of Anthropology because they wanted to study social determinants of health for oral diseases and all of that. So it's like, you can venture out. You can work with the School of I know people, the civil engineering school at the university, they used to work with the College of Public Health because they wanted to make roads more safe. They wanted to make pavements more walkable. So they were all really so it's like you can do anything in the field of public health. And so if any of you were to come here to get your MPH, just be very clear about what you want to do and make sure you do it. You'll always find people to help you.
Yeah, that's
Thank you.
really
Thank you.
okay. So that's quite enriching, Shruti. This is the best part about these rendezvous series. We bump into it, and we get to know varied aspects of why we do and how we do. And that's a lot more added value for students because they derive the related stories, and I'm sure it would have really made all our audience today. And I could also see that we've had some nice comments on our YouTube, which is running there across some of your family members. Everybody who joined in, I guess.
Oh my God.
Yeah. So that's really nice. So I think quickly, if I were to wrap this up, where do you look ahead, Shruti? Like now you've just got into the DDS program, and as we've discovered in this hour or so, that you're someone who you know works upon every opportunity and builds yourself, and there's a lot of learning by the go which happens. So where do you see yourself, and what are your future plans? And yeah, I think I'll just leave it there.
That's a loaded question. I don't know. But no, so I would graduate next year. So I'm looking at I haven't planned anything immediately after next year. So I'm just gonna go with the flow. But I know maybe in a couple of years I know that I want to be an educator, I want to be a researcher, I want to be a clinician. And I think the best place to accomplish all three is a university. So I think that's the sort of setup that I see myself in, holding probably a position in both the School of Public Health and the School of Dental Medicine. So let's see where that takes me. But that's where I see myself.
Okay. So that's really pretty concise. Working in education and services and research, and trying to make the most of it. I think it's pretty much clear what lies ahead for Shruti, and how she wants to take this forward. All right, Shruti, do we have any of your family members who'd like to probably chip in here? Because is anybody joined in through this meeting here? If you could quickly let
I
me know.
think they're on YouTube, so I don't think
Okay,
anyone
I
is
think
here.
all right. Okay, so
Yeah.
they would be watching that. If you can quickly say hi to all of them. Yeah.
Yes.
I can see Sri Devi Raghavan and Priya Shivasubramaniam, and there's an Iyengar's kitchen comment. And yeah, a big shout out to all the lovely dear ones of Shruti here for having taken your time and joining. I think you're really proud of your little girl here. The whole idea of this was to share her journey and bring a perspective to a lot more students who are keen on taking this forward, especially because dentistry being as such a confused, juxtaposed position here, and a lot of the students here lack alacrity as to what they have to do. I think thank you so much all for joining in and taking this possible. Before we end, anybody else would like to chip in, would like to say anything here? Anybody would like to share the thoughts?
I want to ask a question.
Yeah, Vinamrata, go on, please.
Hi, Dr. Shruti.
This is
Hi.
Dr. Shivani, right? Yeah.
Yeah, sir. Why didn't you go for MDS, and why did you choose MPH only? Actually, I am an MDS student, so I am wondering,
Okay.
like, why didn't I choose MPH then?
So
I just avoided that question, Shruti, for about an hour, but then good, Shivani brought it up. Thank you, Shivani. Go on.
Like I said, I've always had an eye for, I'm sure there's a lot you can do with the MDS. There's nothing short, that there's no shortcoming with the MDS. I would say they're like on par. But as a researcher, I felt I would be more suited. I would fit much better in the United States because the amount of money that they endo towards research is a lot more. If you want to get, like, this is just an example, if you want to get like an NIH grant, they want to see if you probably graduated from a school here. I'm not saying that is not the steadfast rule, because I know a lot of people who've come from India, they even got their PhDs in India, came here, and they still do really well in the field of research. But on a much more but what if I'm not that 1% or the 2% who's able to do it, right? So I wanted to come here because I knew it would help me get the sort of grants that I would want if I were to write a grant and get into the field of research. Also, I've always wanted to move to the United States since I was a child. Don't ask me why. There's no reason for it. It's just like a childhood whim and a fascination for what lay beyond my country. So these were two very pivotal things, but I obviously did not come to the decision with a childhood fantasy. Like there was a lot of I did think through whether it made sense financially, whether it made sense with my career, and I felt at that point that it did make sense with my career goals to move here.
One more question. Is MPH of India carries the same weightage in US also?
I unfortunately am not so sure. I know the MDS carries almost an equal weightage.
MPH.
But the MPH in India, I'm not sure because I know just a couple of schools which award the MPH, if I'm not right. Am I right?
No, actually, there are many schools right now in
They
India.
have been. I'll just tell you why. Just clarifying what Shivani raised here. Shruti, now there are a lot of options here for people to pursue MPH because most of the private universities have started off their courses. Again, I do also recommend just a couple of the major institutes where it's more validated and it's more structured, but then I would again not equate it to how, because they have to be emanated from schools of public health, and you see MPH is a pretty old discipline there because of the industry, because of the recruitment drive and everything back in the States, or maybe even in Europe. But in India, it's more of a need based. So I would tell you to look at it at caution and probably research the centers and then go for it. So definitely they don't equate a lot.
Yeah, so I actually know someone who graduated from IHMR in India, but when she wanted to come here for a PhD in public health, it was a little more competitive because there were already so many native MPH graduates who were applying, and they were given preference for that, So she ended up pursuing an MPH again over here so that she could get into a PhD program. So there are a lot of factors which play a role, but that doesn't mean, like, if you were to, it depends on what your goals are. If you want to practice in India, then absolutely the MPH there would make a lot of sense, because every program is tailored to that particular country. Like if you come and study public health over here, they'll tell you the United States Constitution states that, or the public health funding for oral health is so much in the United States. But if you want to practice in India, the MPH program would say the public health funding in India is so much. So you know exactly the sort of environment you're working in, right? So even the course is sort of tailored to the country where you want to practice and the country where you get your degree from. So I don't think it's bad in any way, but if you were to study here because you want to work here, it would make more sense because you'd be familiar with the American health system, their insurance system, their policies and all of that. But if you want to work in India, you're more familiar with all the Indian systems, right? So yeah, I just think it depends on where you want to work ultimately.
Thank you so much.
No problem.
I just have a quick thing to say. It's more like a bit of information. So the last few days, I think I came across a website called teachepi.com. I don't know if you guys are aware of that. I haven't really explored that website in detail, but it did look quite interesting. I think it would be worthwhile for everyone to probably look into it. Teachepi.com. Teachepi on Google will probably take you there.
Okay.
Okay. Teachepi.com.
Teachepi.com, yeah. It was on my Twitter feed, so I'm not watching for it. It just came up, and I thought I should share this. Yeah.
Sure. I think that'd be really helpful for the people here. I think which do it. Shruti, we have a small question here. Yeah. Mansi wants to know: is it okay to pursue MPH after MDS in public health dentistry?
Yes, absolutely. I think you'd be much better at the MPH than like a lot of people who come after the BDS, because you already studied so much, like you've studied an entire course, like spent an extra 3 years on just dental public health. So when you come here, you know exactly what skills you need to acquire. If you feel like, oh, I did not get a lot of education and probably policy, and that's something that I want to work in, you could just focus on that. So there's no limit or restriction to what you can do after the MDS.
Yeah, so because just adding on a little bit to what Shruti said, definitely the MDS in public health dentistry empowers you with more research experience, and your concepts are much more clear because you've had a sound understanding, and you would be better placed to handle and equip yourself with more of public health and policy making and everything, since you already addressed your dental public health issues. So maybe an MPH, or even if that isn't possible, a simple residency program will probably bridge the gap. And like we say, it's time that you stop being a dentist in public health and bring public health into dentistry, and that's how you're going to be addressing the core issue. All right, great. So that has been quite enriching today. I think it's been really good exchange of information, and we've had participants from various corners here, and then we've had teachers, we've had postgraduates and undergraduates who will probably be listening to this. Anybody else? Any more questions before we send off Shruthi to spend the rest of the Sunday? All right. Okay. So I'll just give a
I think
minute.
Shreya has a question.
I just want to ask. So there is a museum in Colorado. Have you visited?
The Colorado Springs for the fluorosis, that one? I
Yeah.
have not. I have not gone out of this area. I don't have a car, so I don't get to go out much. But maybe someday I will.
Yeah, please do that for us.
Is still there, or it's controlled?
I really don't know about it, but I know it's not so far. It's probably an hour away. So maybe if I go there sometime, I'll let you guys know.
Yeah, it's like.
how it is. Yeah.
Great. Go on, Shreya. Finally.
Yes, finally. Ma'am, what I really wanted to know was that what was the exact procedure? Like, how did you apply from India? How did you apply for USF, and what exactly did you need? Like, were there any examinations, and what all is absolutely necessary? For example, if today I want to pursue MPH in, for example, the university where you went to, South Florida. So what all exams and what all things do I absolutely need in order to get into the program?
So there are two exams which are compulsory. You give your GRE and then the TOEFL exam. Try to do well. I mean, try to do well on your GRE, especially if you want epidemiology, biostats, because it's a very quant heavy subject, right? Like, like you're doing a lot of math and statistics. So your quant score needs to be high for that. And then TOEFL, because you're going to be writing a lot of papers over here, everything in English. So they're like, how's your English? And then that's it. And then a continued interest in the field of public health. So just keep tab of everything that you're doing. So this is a paper that I presented, or this is a poster that I presented. I was involved in XYZ project and things like that. So keep a tab of all of it. And that's it. So you apply through a portal called the SOPHAS, which is the School of Public Health Application System, SOPHAS. And you just have to go there, fill out everything that they're asking, your personal details. You'll need your transcripts, your BDS, MDS transcripts from the university you graduated from. That's all I can think of. So you apply with all of this. Each school has a slightly different requirement, like some might say, write an extra essay on what is your research interest. Some might not ask you that sort of an essay. You'll just have one statement of purpose. Have good letters of recommendation, like from professors who know you very well. You don't necessarily have to get your letters from really famous people. They need to know you very well, because they should be like, I worked with her closely and I know she's really good at this, and this. So things like that. And then you apply through SOPHAS and you're good. That's it. So you wait after that. And it's not a very difficult application process, I would say. And I think if you have a clear reason on why you want to study it, I don't think any school, even like the top ones, would say no.
And ma'am, can you quickly tell me how exactly did you prepare for your GRE?
You have the set of Princeton Review books, and that's I can only remember Princeton Review books. I don't remember any other books. I would just I just practiced through that. It's not a difficult exam. It's just high school math, and English is a little hard. So for the English, maybe just start. I don't remember. It feels like it's such a long time ago that I did it, but it wasn't so long. For vocab, I guess I would just read a lot of essays and newspapers and difficult articles, because those are the sort of passages they give. You have these books, for GRE. I can actually look it up and tell you. Kaplan,
Barron's Review.
Barron's,
Review,
yeah. Yeah, so learn all those words maybe, because you'll have like literally a vocabulary test over there. But the math is usually hard. Even if your verbal scores are slightly on a slightly lower scale, it's fine. But make sure your math is good, and math is not hard because it's high school math. Because they're like, hey, you want to study biostatistics? I want to make sure you know your math, your basic math well. Yeah. But it's not a very difficult exam. Maybe if you could study like dedicatedly for 2 months, then you'll be fine.
Thank you, ma'am.
No problem.
Yes. So get set, go, Shreya. I think you've got all the list of books. You've got a lot of homework today to do.
Yes.
All right. I'm assuming you're presently in your internship or final year or thing.
I'm a first year PG student. I'm currently pursuing PCD, Public Health and History from PGITS Rotterdam.
Okay, great.
Yeah.
Great. That's nice.
Nice.
Okay, so I think time to wrap this up. I think we're really thankful to Shruthi for doing this, for actually answering so many of our queries from all our group of participants today. Quickly, before we wind this up, what is Shruthi watching on Netflix these days?
I was watching this show called Selling Sunset, where they're just selling all these really rich houses. I like houses a lot. So I was just watching people sell houses, but that's it.
Great.
Not a lot of time for Netflix off late.
And yes, of course, please do gather some trivia for us from the museum at Colorado. We would really like to tell back in our classes, our students, that okay, we have one of our friends there who's been there in the place where McKay and all of them from the Colorado Springs. We bring you all that, a little bit of trivia for just their curiosity.
Absolutely.
I think me and Manjunath sir will be looking forward for that.
Absolutely.
All right. Thank you so much, everybody. Thank you, Nash. Thank you, Manjunath sir.
Thank you. It's been a pleasure.
All the participants,
Thank you. It was a wonderful
all of the
session
participants
and,
who've taken out time. It's almost past dinner time. But thank you all so much for joining in. This is what actually makes it is really purposeful, sharing perspectives and exchange of information from different people and different personalities. And you get to know different sides of the story. And that gives you a wider horizon into working on what actually is close to your heart. Somehow that's how you actually figure out. And what's really required today is more of a well-formed mind rather than a well-fed mind. We have a knowledge overload, or information overload across us, but then we need to develop the pragmatism to understand the rationale and to find out choices and to actually make more informed decisions in the best interest of our patients and for dentistry as a whole. So thank you all so much for joining in here. We'll see you soon. Thank you so much, Shruthi. Any closing remarks?
So, hi.
Yeah.
Hi, this is Satya, Shruti's cousin. So,
Oh my God.
I thought probably let me just speak few words. So, looking at Shruti, knowing her, she's always dedicated and focused and wants where she knows where she wants to go and always desire to go there, irrespective of what other people say. That's something what I've admired, and I think people should admire from her. So it was a nice session, Shruti. It was nice. Though I didn't understand the doctor's words, being an infosec professional. So, but overall it was so good. And yeah, I thought I should jump in and say this. Thank you.
Oh, thank you so much. That's really kind of you, sir. I think that was really nice of Mr. Satya to chip in and say. Yes,
Awesome. Yeah, I don't have anything to say, honestly. It was so nice to talk to all of you, and it's like I've always wanted to belong to a fraternity, and now I feel like I belong to a public health fraternity, and that feels so good. Yeah.
Thank you so much. I think
that's
really
we would like to interact you again. Yeah, Dr. Renzi.
yeah, absolutely, sir.
Future after she completes her DDS.
Absolutely.
So we can have another Rendezvous with Dr.
Surely,
Shruthi.
definitely.
Absolutely,
Surely,
sir.
I think this just keeps it, open and to more future possibilities. In the end, again, like I said, it's about galvanizing on our energies and sharing our experiences for the betterment of our profession and specialty as a whole. So thank you all so much. Thank you so much, Shruti, for doing this and for sharing out your experiences. Have an awesome time ahead. All the love and regards from everybody here in India. I'm sure your family. A big shout out to everyone who's responsible for where you are today, and you are really an inspiration because thinking about doing things and actually pursuing them persistently, we can see that throughout your journey. When I first I mean, I didn't know Shruti much earlier. It was just one of the random exchanges, and then we got to talking, and somehow in the first half an hour I could see a story. Then I was like, Shruti, let's do a rendezvous session, because I don't know what it is, but you would have a lot to share, and our students would, and our educators would really benefit from it. And I'm so happy that it actually initialized and did come to reality today. So thank you so much. Looking forward for more collaborations and enrichment of our students. Thank you everybody else for joining in today. Advanced wishes on the festival Ugadi coming up to everybody. Stay home, stay connected, stay safe, and have a good time, and see you all very soon. Bye-bye and goodbye and good night.
Thank you
Thank
very
you.
much. Thank you all.
Thank you. Best wishes, Dr. Shruti.
Thank you so much, sir. See you all.